Hi folks, this is Yvette from YvetteLaboy.com. I am speaking today about lupus and depression. Okay, I'm sharing this with my group. I'm sharing it here. Okay. All right. I'm talking about lupus and depression, and so I'm going to start, folks. If you have any questions, you can post them below. I'm not sure if I could see them or not. Hey, Patricia, thank you for joining in. Hey, Flynn, thank you for joining in. Thank you, Sarah, for joining in. Thank you, Victor, for joining in. Thank you all for being here. I greatly appreciate it. Hey, cuz, how are you? Alrighty, I'm going to start. So, systemic lupus, SLE, is a chronic autoimmune condition which affects many organs and systems in the body. And the link between lupus and depression is controversial, but it's known because known the negative life events, lupus activity, and the treatment for disease can be capable of contributing to clinical depression. Okay, so neuron psychiatric symptoms are frequent with people who have SLE. With a range of between 13 to 75%. The psychiatric symptoms may vary from mild personality disorder to severe psychiatric behavior, severe psychotic behavior, excuse me. Hey Larry, how you doing? See my Halloween decorations in the back? This is my favorite time of the year, the fall Halloween. I can't wait. And Halloween opens this Friday. I'm just pumped. Anyway, back to what I was saying. This, psychiatric symptoms may vary from mild personality disorder to severe psychotic behavior, like I was saying. So about 50% of patients develop depression. Hey, Edwin, thank you for joining in. The management of depression and lupus rests on a combination of treating the underlying lupus itself as well as adding antidepressants, therapy. So people are considered clinically depressed when they have a depressed or irritable mood, decreased energy, other symptoms that I will go over in a few, okay, because I have a list I want to go over, give to you guys. And the last, and that will last for more than a few weeks and severe enough to disrupt daily life. So probably the best single marker for clinical depression is loss of interest. And what I mean by that is loss of interest in activities and responsibility that used to be important to the person. For example, if you find yourself saying, oh, I used to enjoy cooking and doing so-and-so, whatever it is that you enjoy doing, and I don't enjoy doing it anymore. It's not important to you anymore. These things. So clinical depression may be brought on by lupus, if you have lupus, by the various medications used as well, especially the steroids, to treat the lupus, and or by other factors and forces in the person's life that are not related to lupus. For reasons that are not entirely understood, people with chronic disease often experience this type of depression. You know, I mean, I'm sure being told that you have a chronic disease can depress you. You know, this is normal, but I'm talking about something that's a little bit deeper than that. And like I said, the steroids can contribute to that as well, especially if you're on high levels of high milligrams of the steroid. Anyway, like I said before, these are some of the most common psychological and physical symptoms of clinical depression. Feelings of hopelessness and helplessness, sadness, crying often without reason, insomnia or restlessness, you know, not being able to sleep, or the opposite, sleeping too much, changes in appetite leading to weight loss or weight gain, feelings of uneasiness, anxiety, irritability, feelings of guilt or regret, lowered self-esteem, what else? Feelings of uneasiness, I already said that, feelings of guilt or regret, feeling that you're worthless, inability to concentrate or difficulty with thinking, diminished memory and recall, indecisiveness. Okay, it's another one, lack of interest in things formerly enjoyed, like I said before. Thank you for joining in, Leslie. Ooh, my list here. Okay. I lost it. Lack of energy, generally slowing down or clouding of mental functions, diminished sexual interest or performance, and thinking about death and suicide. This all these things are signs that you may be suffering from depression. So clinical depression, right, may not be recognized in people with lupus because of the symptoms that you get with lupus when you have active lupus can be similar. For example, thank you for joining in, Norma and Leslie. Lack of energy, trouble sleeping, diminished sexual interest. These are all can be attributed to lupus. However, these are also symptoms of clinical depression. So a number of factors can contribute to clinical depression in people with chronic illness. And the most common cause is emotional drain from stress of coping with the complications of the physical illness. And if you're suffering from lupus or if you suffer from any sort of chronic condition, you understand what I'm talking about. It can be extremely stressful and as well extremely depressing for the person who is suffering from the condition. So add to economic, social, and workplace concerns. Moreover, various medications used to treat the lupus or the chronic condition, especially high doses of steroids, like I said, such as prednisone, may cause clinical depression. More than like 40 milligrams in some people of the prednisone. When certain organs or organ symptoms are affected by lupus, such as the brain, heart, kidney, like I told you folks in the past, I had involvement with my heart. The lupus had attacked my heart on 2 occasions, and I had... hey Sajad, how are you? Nice to see you. God bless you too, my friend. Long time no see. Hope all is going well. So when certain organs are involved and are affected, like the brain, the heart, kidneys, clinical depression may occur. And a lupus flare can also trigger clinical depression, both because you feel ill and because it may seem as though you're never going to be free of the condition. Also, facts about clinical depression and lupus that I want to share is between 50 to 60% of people with chronic illness will experience clinical depression. And clinical depression may be a result in which lupus physically affects your body. Some of the medications to treat the lupus, especially the steroids, like I said before, 40 milligrams or more, 40 to 60 milligrams or more, can play a role in causing clinical depression in people. And clinical depression may be a result of a continuous series of emotional and psychological stressors associated with living with a chronic disease. Clinical depression may also be a result of neurological problems, experiences unrelated to the lupus. And also know that lupus can also affect your nervous system as well and brain health. Clinical depression also produces anxiety, which may aggravate physical symptoms. For example, like a headache, stomach pain, etc. 2 common feelings associated with clinical depression are hopelessness and helplessness, like I said before. And people who feel hopeless believe that their distressing symptoms may never improve. And they just lose hope. And it's really, really so sad. Don't ever lose hope, because there is always hope. You know, hold on. Possibilities exist. That's what I say about hope. And people who feel helpless believe that they are beyond help, that no one cares enough to help them or could succeed in helping them, even if they try. Don't ever think that. And I know that when you're in the current situation, that it's easier said than done, but I've been there. I suffered through this disease. I was able to heal my body, and now I'm pouring that wisdom into other people. Don't ever give up. Know that you are powerful and that you can create change in your life. You know, you can make things happen. You just have to learn and educate yourself on what you need to do in order to become healthier and happier and live a more vibrant life. And like I said, any of you have questions, I'm always happy to share information with you folks. You know, I have my programs, but even people who don't do my programs, if they contact me and ask me questions, I'm more than happy to share with them any information that they feel may contribute to them feeling healthier, happier, or help them in any sort of way. So don't forget that. So what can you do? Always check your gut first. And why do I say that? Folks who know me know why I say this. And I will speak more about this later. Those who suffer with depression and lupus may also have gut health issues that need to be repaired and rebalanced. Remember that the gut and the brain, they communicate, and I'm going to talk about that later a little bit. Seek psychotherapy. Clinical depression generally improves with a combination of psychotherapy and medication. You should not feel embarrassed or hesitant about asking your doctor for a referral to a psychiatrist or a psychologist or a therapist. You want to help yourself, right? Psychotherapy under the guidance of a trained professional can also help you learn to understand your feelings. Hey Deirdre, thank you for joining in. Long time no see, girl. Your illness and your relationships, and to cope more effectively with stress. I mean, stress is a killer, okay, especially if you have an autoimmune condition. Cognitive therapy, a special type of psychotherapy, can be very helpful when you're living with a chronic illness. Support groups led by a therapist or trained counselor, such as those organized by certain foundations, like the Lupus Foundation, any sort of autoimmune condition you may have or illness, there's always going to be some sort of foundation that's there to give you the support. So seek them out. Also, antidepressants and medications, several types of prescription drugs can help ease the effects of clinical depression. Anti-anxiety medicines that are also available to reduce worry and fear feelings, and some people can improve and can occur in a matter of weeks once the medication is started. Now, I'm not advocating people to take medicine or not to take medicine. That's not what I'm here for. I'm here to kind of just give you the information, okay? I just wanted to say that. Also, find ways to decrease pain. Chronic pain can be a factor in the development of clinical depression. Why? Because you're not able to move the body and you're feeling pain. When we move our body, we feel good. When we can work out, when we can do things, we feel good. And when you're not able to do that, you may feel depressed, you may feel anxiety, you may feel like, oh God, I can't, do this because I'm kind of locked in because of all this pain. So try to find ways to reduce the pain. Besides medication, which is also may play a role in the clinical depression, like I said before, experts often recommend non-medical medication ways to conquer or at least reduce chronic pain, such as yoga, Tai Chi, Pilates, acupuncture, biofeedback, meditation, behavioral changes, play therapy, and chiropractic care. All of these are good for pain when you're dealing with a chronic condition. Okay, you may consider over-the-counter treatments for your depression and pain. Herbs such as kava. Okay, I use this herb a lot with a lot of my clients. It's good for anxiety. And it really works. St. John's wort, SAMe, S-A-M-E, short for, I can't even pronounce it. S-andioxylmethane, I think that's the name. Also known as SAMe, S-A-M -E. It's not approved by the U.S. or the FDA to treat depression, but it is used in Europe. Lavender oil is used as an inhalant in sachets, essential oils, sprays or lotions. Lavender is great. Valerian root is great for anxiety, and it does have sleep-inducing qualities to it. There is rhodolia, I may be pronouncing it wrong, but it also goes by the name of golden gate or arctic root. It's an adaptogenic herb, and that also helps. Ashwagandha, which is an Ayurvedic herb, works well as a stress reducer. Chamomile, like basic chamomile, nice chamomile tea, beneficials for those suffering with both depression and anxiety. And another great herb is rosemary. You can make rosemary tea, or you can cook with rosemary. They also have the rosemary tincture that you can add to water and drink that. These are just a few herbal remedies that are available. Know that it is important to discuss all herbs and supplements with your rheumatologist or primary care provider before you start taking them, okay? I don't want to be responsible for anybody getting any drug interactions with herbs and stuff like that. Or if you want, you can reach out to me and I can let you know if it works or not with what you're taking. Also, if you can, try to get more exercise. Like I said before, when the body is physically able, take part in some sort of physical activity every day. This can be as simple as walking your dog, or just taking a walk, yard work, gardening, window shopping at the mall, just getting the body moving, improve your sleep habits. Not getting enough restful sleep can cause many health problems, including symptoms of clinical depression. To improve your sleep, and in turn your mental health being too. So you want to rest, Plus you don't want to feel tired because you feel crappy the next day. Get 7 to 8 hours of sleep in a 24-hour period. Lack of sleep can lower your immune system, okay? And remember that lupus is a condition, it deals with your autoimmune system. And it can lower your energy too if you don't get enough sleep, obviously. Do aerobic exercise every day, such as a brisk walk, like I said. Basically whatever you can manage. Avoid caffeine as much as you can, nicotine, alcohol, especially several hours before going to bed. Know which medications keep you from sleeping and take those early in the day. Okay, so you want to do that. Have a good mattress, comfortable bed linens, the right room temperature, and the right amount of darkness. I know I can't sleep when there's light. I can't. It ruins it for me. Also, throughout the day, include rest periods when you need them. And if you're still not getting enough sleep, find a good sleep center or talk with your doctor to see what's causing you not to sleep. Build a support system. Stay in touch with family members, friends. Make phone calls. Consider asking or adding an animal companion to your family. Join a group where you can do activities that you enjoy with these groups. I know they have in New York City, they have a lot of these meetup groups and stuff like that for different things. I've done them for hiking and climbing, but they have so many different ones. You can look them up, meetup.com. Also, change your self-talk, which is so important. Feelings of anger and self-pity can bring on unproductive thoughts. For example, thinking, oh, it's not fair. I haven't done anything to anyone. Why am I sick? Why me? Why me? Or I'm too weak to fight off this illness. No. You don't want this bad self-talk. Iris, thank you for joining in. Mark, thank you for joining in. You don't want this negative self-talk, right? Replace negative self-defeating inner language with truthful, productive thoughts such as, okay, I may feel lousy, but I am grateful. I'm alive. I have a loving spouse or significant other. I have great children. I have people who care about me, have good friends. I woke up this morning. I have another day of life. Look at the small things that you can be grateful for, and celebrate them. And don't think about the negative, because you don't need that in your life. It's just going to cause you to be more depressed and feel crappy, and you don't want to do that. Okay? Also, becoming a volunteer, when you help other people, it can provide for real emotional benefits. Helping with a charitable cause that is meaningful. Thanksgiving is just around the corner. There's so many people out there that have less than what we have. Go out there and share. Maybe you want to go and help at a soup kitchen. Maybe you have some old coats that you want to give to a shelter. All these things help you to feel better because you're giving. When we give to others, we do feel better. So, think about doing things like this. And strive to accept the new you. Pace yourself and don't feel badly about delegating some of your responsibilities because you're not feeling good. Okay? Ask for help and accept help graciously. A lot of times we don't want to accept help, It doesn't mean you're weak or that you can't do it, but, sometimes we just need help. With certain things. Focus on what you have and what you can do, rather on what you don't have and cannot do. Okay? Because you're just wasting time doing that. So those who suffer with depression and lupus may also have gut health issues, okay? And there are several studies that show the possibility of intestinal microbiota may affect cognitive function, believe it or not. And I spoke about this in the past. And behavior by direct reprogramming of the hypothalamus pituitary adrenal axis, the HPA, and that's a common pathway activated in response to infection and upset by psychological stressors. Okay, I had a client who came to me, hey Herlinda, how are you? Long time no see, girl. Hope you're doing well. I had a client who came to me on antidepressants after working on her gut and tweaking her diet and working on some bacterial infections. She no longer needed her medication for depression and anxiety. And she felt happier and, all that from just working on her gut health. So know that the gut is the second brain. It has its own nervous system, okay? It contains as many neurons as the spinal cord and many transmitters like the brain. It's thought that this system, that the gut, immune system, and brain speak with each other through that system, okay? So there is a gut health and brain connection, folks. I did a video on that. You could check on my YouTube page, Yvette LaBoy, Lupus Wellness Coach. I have a video on that. So our body creates an enzyme when we become anxious as well as depressed, and the severity of depression can be linked to specific bacteria in the gut. A recent study examined the specific differences in the bacterial makeup of the microbiome in patients with major depressive disorder in comparison with healthy individuals. So they noticed significant differences between these two groups. So the microbiome was far more unbalanced in those with depression than in healthy individuals. Okay, so again, the brain and gut connection. And why is it so important to have a healthy gut? Additionally, the severity of depressive symptoms was related to the amount of specific bacterium. I'm gonna try to pronounce this, okay, folks? Be patient with me. Faecalibacterium, I said it right, woo, which was associated with more severe depression, okay? So this is why gut health is so important to the core of all health. A lot of disease starts in the gut. And I found in many of my clients, once the gut was repaired and rebalanced, a lot of the symptoms of anxiety and depression disappeared. And in others, it completely cleared up. So a way of finding out if you have pathogens in the gut, there is a test that you can take, because there are other tests that miss this, but by taking this test, it's a stool test. It's called the GI map test, and it's an advanced stool test capable of finding pathogens that in the gut. So this way you know that you need to repair your gut so you can feel healthier, okay? And basically, this is all I have to share with you folks tonight. If you like this video, you like this live chat, share it with other people who you think may get something from it, who it resonates with, who has lupus or an autoimmune condition. By all means, please share this to them. They may learn something from it. If you learn something from it, great. I'm happy. But like I said, if you like this video, share it with others. Follow me on YouTube, which is Yvette LaBoy, Lupus Wellness Coach. Here, my business page is Yvette LaBoy, Lupus Wellness Coach. On Instagram, I am One Holistic Diva. On Twitter, I'm Holistic Gal, and my website is YvetteLaBoy.com. Thank you for being with me tonight. Happy fall. I'm so happy the weather It's getting cooler and it's so nice. I love the fall. Went pumpkin picking and apple picking today. Had a great time. Anyway, folks, thank you for being here. I'll see you next week on my next live chat. If there is a topic that you would like me to discuss on my live chat related to lupus or autoimmune conditions, hit me up here. You can inbox me here, or you can inbox me at inspiredwellness@yahoo.com or info@YvetteLeBoy.com. Thank you for joining me. Mwah. Good night. Have a great week. Bye.